My Lords, first oral question, Lord Black of Brentwood.
My Lords, I beg leave to ask the question standing in my name on the order paper and declare interest as a patron of the Terence Higgins Trust.
We remain committed to improving sexual health in England. The UK Health Security Agency conducts comprehensive surveillance of sexually transmitted infections and supports local areas to use this data to inform sexual health services delivery. We are working with them and other key delivery stakeholders to explore options for the best use of both existing and innovative preventative interventions, as well as strengthening messages to the public on how to reduce the transmission of STIs.
My Lords, PrEP has been a game changer in the fight against HIV, and making sure as many people as possible at risk of infection have access to it is fundamental to meeting the target of ending new HIV cases by 2030. But at the moment, we're failing to ensure that access because of the immense pressure on sexual health services. Nearly 60% of people are forced to wait more than 3 months to access PrEP through that route. Does my noble friend agree that one way to deal with this problem is to make PrEP available through pharmacists, as contraception now is, an initiative backed by the Royal Pharmaceutical Society? And does he recognise that such a policy, in line with the ambition of Pharmacy First, would not just relieve pressure on sexual health services, but also encourage uptake among women, who make up 31% of people accessing HIV care, but represent only 2% of PrEP users?
Well, I'd first like to thank my noble friend for all the work that he does in this space, and absolutely agree that we are actually leaders in the world in terms of use of PrEP. We have 86,000 people who are currently using it. It is a key prevention tool, but it's something that we want to expand as widely as possible. There's an excellent pilot actually happening in Brighton at the moment where you can get PrEP online, and I absolutely agree we should be looking at Pharmacy First as a way that we can expand that even further.
Could I ask the Minister whether he remembers the reports on the AIDS campaign in the 1980s, which showed not just a reduction in AIDS, but a fall in all other sexually transmitted diseases generally? I wonder if the Minister would say how much is now being spent on such public education campaigns in this area, and whether this spending is increasing or decreasing.
So overall, we spend £3.5 billion on public health. I don't have the breakdown of the advertising within that, but I will happily follow up with that. That's a small increase over the last year. Education is key to all of this. As you know, part of the reason for some of the increases in sexual transmitted diseases is actually people used to use condoms because they were scared about well, two things: pregnancy and infection of HIV. And as both those risks have gone down, so has the decrease in the use of condoms, which has then resulted in the higher level of sexually transmitted diseases. So education is key.
In 2022, the rate of STI infection went up by 22%, and at the same time, the public health budget has been reduced by 29%. The strain on those services is now intolerable. Is it not time to have a proper, real increase in that budget?
Yeah.
Well, firstly, the figures are slightly misleading because, of course, that was the comparison to the COVID year, and there's much less testing in the COVID year. So, in fact, if you look at it versus pre-pandemic, the numbers versus 2019 are actually 16% down. So that is the real comparison that we should look at here. At the same time, I think we would all agree 3.5 billion is a big investment in this space. It has gone up slightly over the last year, but as I mentioned earlier, education in this space is also key.
Back to the issue raised by the Noble Lord Black, which is whether community pharmacies could play a bigger role in relation to PrEP. Does he accept that whilst there is much that community pharmacy could do, they're facing a fundamental financial crisis at the moment, with many going out of business? Will the government accept it's going to have to give more support to community pharmacy to do the kind of things the Noble Lord is asking?
Yes, I believe there is a real win-win possibility here where we can get more services through Pharmacy First, which is obviously good in terms of primary care access, and give further support to the pharmacies. I was having this conversation just this morning in terms of we made contraception available through the pharmacies in April 23. We're getting the results back from that shortly, and absolutely things such as sexual health and PrEP and other things such as that is absolutely what we're looking at.
My Lords, in view of the fact it's often the hardest to reach communities that suffer the greatest pain when you talk about uplift in sexual transmitted disease, what maybe the Minister could tell us what work the government is doing to reach these communities and particularly the young around educating them to protect themselves?
Yes, again, my noble friend is absolutely right. The young people, 15 to 24-year-olds, are one of the highest levels of that. In 2020, we actually made compulsory relationship, sex and health education classes available compulsory in schools. We're currently reviewing that to see the effectiveness of it with the view to expanding it further.
Would the noble Lord the Minister tell the House what is the current rate of take-up of vaccination against HPV, human papillomavirus, and what efforts are being made to make sure that all of those who should be vaccinated are vaccinated?
I will need to come back with the exact figure in terms of the vaccination rate. I know it is proving quite effective on that, so that is an important thing on that. The measures, we're investing 25 million in the women's health hubs precisely to enable these sorts of vaccination programmes on that, but happily follow up in writing in terms of the detail.
My Lords, does my noble friend agree that in this technological age it is actually very, very important that people are able to access everything they need from the NHS via the phone or a laptop? My Lords, I'm working to ensure all women have access to their maternity record via the NHS app, but only 23% of sexual health clinics currently allow online booking. Could my noble friend tell me how the government plans to address this issue?
I thank my noble friend, and as she knows, I'm a very big advocate of everything we can do in terms of the app, and we are absolutely looking to extend the services. That will include the sexual health clinics. In the last year alone, we've increased from about 10% of GPs allowing you to see your records to around about 70% today. Sexual health clinics are clearly an area that we need to be doing next.
With a real terms cut of nearly 1/3 to sexual health services over the last 8 years, it is ever more difficult to get an appointment. So given that STIs have increased by 24% just last year alone, what assessment has the government made of the potential to improve access to sexual health services through the universal provision of postal STI tests in England, something that Wales already offers?
The first thing I would say on all of this is actually we are leading the world in all these areas. There was actually a recent survey done across the European nations where we came out top in sexual reproduction and health services. So I want to put that on the record. We were quite rightly, it was recognised just last week, everything we're doing in the HIV space, as well as part of all of this. So again, this is another area that we're looking to widen the access as much as possible. I mentioned the online examples of Brighton. Pharmacy First, I mentioned to the Lord Hunt on this all. So absolutely, we're looking to make sure people can get this as widely as possible, and testing in the same way as well.
Chlamydia is a cause of infertility. There is a vaccine developed and I think in use. How far have we got with a programme of vaccination against chlamydia in both boys and girls?
The noble Lord is correct. About 50% of all cases are of chlamydia, and a lot of people, it is undetectable. That's why we've started on the screening programmes now of chlamydia in women, so that they can pick it up whether it is undetected, because we know that it can be done. We have got a programme of chlamydia vaccinations, as the noble Lord mentions, to both females, and I think the rate is around 30% of boys now from memory, but I will come back with those exact numbers in writing.
My Lords, the biggest single cause of deaths globally of people with AIDS is tuberculosis, and co-infection is a real issue. While, of course, the problem with tuberculosis is not nearly as serious here at home, there are still cases, thousands a year, and they have started to go up again. Would my noble friend confirm that post-COVID, the government will look again at what more needs to be done to eliminate tuberculosis, an entirely treatable disease, from our shores?
Yes, no, absolutely. As we are in terms of all cases, again, I want to be clear on this. Take the AIDS that my noble friend mentioned. On the UN targets of 95%, 95%, 95% in terms of diagnosis, treatment, and viral load detection. We're actually at 95%, 98%, 98%. We're beating those. We are leading in the world on this.
Second oral question, Lord Scriven.
I beg leave to ask the question standing on my name.